Ladies and gentlemen, thank you all so much for joining us live on this special edition of the Voice of Reason podcast. My name is Sean Phillips. As always, I am joined with my co-host, Mr. Andy Van Beber. And as we kick things off tonight on this Friday, it's a special episode. We actually have two special guests starting us off, and that is Briley and Bryson Van Beber. How are you guys doing over there today?
He's asking, how are you guys doing? You can say, tell him how
I
you...
cannot hear.
I know you can't hear. Here.
I can hear blah, blah, blah.
Here, put that on. There you go. He asked, how are you doing today?
I'm good. Oh,
Same.
You're good?
that sounds so weird.
Good.
It sounds like the audio.
Since it was a Friday night, they wanted to be a part of the fun and see what we do, so.
Of course. No, we're glad to have him on the show.
But, we definitely wanted, the original plan for tonight, I guess we could say, is that we were going to meet together at, the Capitol Plaza Hotel.
The Capitol Plaza Hotel here in Jeff City, Missouri, but we ran into a little roadblock this week.
Just a tad bit of a roadblock, and the fact is that on Monday I was I was doing my regular thing on Monday, and I guess you could just say the COVID jumped up and got us.
Big time.
Yeah.
Big time. But first and foremost, the most important thing is how are you and everyone feeling in your household today? How are you guys doing?
We're, Janine's probably the one who's the last to the party. We both tested positive on, hold on a second here. We both tested positive on Monday. I felt like total garbage on Monday, but, we both got the infusion, which we'll talk more about here in a minute. Bryson, there he is right there. Bryson he's had a little bit of a cough the last couple of days, and we've all, and as this is part of the reason why I brought them in with us, because we've all been pretty much stuck together for the last, this is day 5. Yep, this is day 5. So this is day 5 of our quarantine. Well, it's day 4, but we'll talk about that later too. According to Pike County Health Department, it's day 5 of our quarantine. And yeah, I'm still trying to, get through all that and everything. But
sure.
Yeah. But Janine has developed a fever in the last 24 hours, and she's sleeping as we speak. She took some medicine. She went right on to sleep. I haven't had fever this is my second full day without a fever. So it's, it's, I never would have imagined that as I got it, but the guys have had to do school remotely. You want to say anything about what do you think? What's it been like doing school? Come over here. What has it been like doing school from home?
Crappy.
Yeah. Bryson, what have you liked being away from all your friends and everything this week? No.
Our quarantine is BS.
Did you hear that, Sean? He said
I did, yeah.
He said our quarantine is BS.
Yeah, so tell us a little bit about the kids' quarantine, because in our conversations, that's been one of the more unique parts of all this, and just unfortunate truce to the kind of nonsense you guys are dealing with. So give us the rundown about how your quarantine's working versus your kids' quarantine.
All right, we'll see. Yeah, go ahead and go, guys. We'll see you later.
Taking my popcorn.
All right, take your popcorn with you. Thank you for being on, guys.
Good night, guys. Thanks for being on.
We only been on for a minute.
I know. Yes, dear.
That's
See,
unfair.
this is what
I deserve a refund.
You deserve a refund. Okay, but no. When we went in on Monday morning just to set a little bit of the timeline. I'm sorry. I started feeling symptoms Monday afternoon, and then on Tuesday, Monday afternoon, I thought, man, I'm just totally shot, and Janine just said, take a rest, we'll be fine. Monday night I had a 101 point or a 100 degree fever, which is when I get fevers, that's just normally what it is. And so I was like, okay. And so I called my boss. I said, hey, boss, I've got a low grade fever. He said, but I said, I should be able, I'll see how I am in the morning. When I got up in the morning, we went, I was running 101.5 fever, and it's been a long time since I've had a fever like that. And I was like, okay. So I called my boss, said, hey, I'm not going to make it. He said, just, email me some plans. And Janine says, well, I'm not quite feeling right. We need to go get tested. No discussion. My wife, when it comes to this kind of stuff, she's really, she's on top of that. And she's like, we're going to get tested. So no question on that. And so we went and got tested. And we thought it was going to be influenza, one of the influenzas. So we had influenza A, influenza B. We didn't get a strep test, and then we had the COVID test. And I thought he was going to come back in there and say, hey, you got influenza A or B. And he came back in, and he says, he said, 10 minutes later comes in, you both are positive for COVID. I said, you're kidding me. He said, are you vaccinated? I said, of course, we're both vaccinated. And at that point, I was just bumfuzzled. I was like, we're both vaccinated, and he's like, well, where do you both work at? My wife's like, well, I work from home. And I said, I work at Clopton. He said, we've actually had an influx of cases the last 2 days. And I'm like, really? And so he said, so you're quarantined. You need to quarantine until, since you're vaccinated, you can't go back to school until Wednesday the 17th. And I said, okay, that's 10 days. That's fair enough. He said, but your kids are going to have to quarantine 2 weeks after, or so he's like 2 weeks after the 17th, or 10 days after for 10 more days after the 17th. And I looked at him and I was like, okay, that doesn't make any sense. He said, hey, I don't make the rules. And he said, if you want to talk, he said, you can call Pike County Health Department. He said, he wasn't crazy about it either. So I was like, okay. So he said, he said, I'm going to recommend, you do not have to, but he said, I'm going to recommend going to Pike County Hospital and getting what's called a monoclonal antibodies infusion. And I said, okay. And I'd never heard of this, had not heard of this at all. And so they get us in there. They keep the stuff in deep freeze, and they had to thaw it out. And we went and got the kids. By the time we got to the hospital, it was ready to go. Took us 20 minutes to give me the infusion, and then I had to sit there for an hour. And he said, and the nurse there said, you're going to feel like crap for the next 24 hours. She said, but after that, you're going to feel right as rain. I said, okay. And so we did. And so that was pretty much the end of that day. I felt like garbage. Next day, so we get the phone call from Pike County Health Department on Tuesday or on Wednesday confirming everything. And they said, you can go back. You guys are quarantined until November 19th. And I said, she said to me, but your kids are going to have to go 10 more days after that. And I said, no, ma'am. She said, no, they have to. I said, and by this time we had gotten the kids tested. And she said, no, they have this is what they have to do. This is what they have to do. And I said, no, ma'am, no. And I said some other things. I said some other unchrist-like things. And so basically I was very upset. And so I ended up calling my school. I called my administrator. I called the kids administrator. I called the school nurse. And all of them said the same thing. We have to abide by what Pike County says. And so then, the strange thing then happens yesterday. So yesterday, I get a phone call from a friend, and I promised this friend I wouldn't use their name. So this friend said to me, you need to call the state health department. I said, okay. I said, what's going on? He said, just call the state health department and tell them your situation and let them know what's going on and see what they say. He said, because I have a friend who's telling me that Pike County is pretty much overstepping their boundary on this, and you need to kind of follow up with this. And I'm like, oh, all right. So I follow up with it, and I called them this morning. So I called them this morning because they were closed for Veterans Day yesterday, and I said, here's my situation. I said, and I explained, and I said, I understand that I have to be quarantined until the 17th, next Wednesday. He's like, yep, that's correct. And I said, the reason why I'm calling, though, is on regards to my children. And I said, what are the state's guidelines regarding family members? And they said, well, the first thing, of course, he asked is, are they vaccinated? I said, no, sir. They're 9 and 10. They're not vaccinated. He says, okay. He said, have you been anywhere else or been around anybody else? I said, no. I said, the kids probably got the same place. They were at the same place I got from school, and they're with me now. And he said, they haven't. And I said, they're with me. He said, per our state guidelines, they have to quarantine, since they're not vaccinated, they have to quarantine with you till your date plus 4 more days, which would be a week from tomorrow.
Mm-hmm.
And I said, all right. I said, then why is Pike County telling us that they have to quarantine 10 more days? And he said, there are some counties that are doing that, and we are allowing local officials to put into place what they think is best for their area. And I said, so you're telling me that Pike County, Missouri can supersede the authority of the Missouri Health Department? Yes, they can. And so I go to Pike County's webpage. And on there is it's a flow chart that the Department of Elementary and Secondary Education has put forward, and it says you follow the flow chart. I've been exposed to COVID. Have you been exposed to COVID? Yes or no? Yes. Okay. Then you go down, and then are you vaccinated? Yes, no. No. Okay. Were you wearing a mask when you were exposed? No. Okay. Go down. Are you experiencing any symptoms? No. And this is for my kids, of course. Nope. Okay. Quarantine in place for 14 days. End of story. But the Pike County Health Department says, nope, you're going to show and so by this point, all I'm doing is getting them basically 2 more days back. But when you have a special needs child like my daughter who needs, and by the way, our Clopton staff has been lights out for us. I mean, they have, Bradley's special ed teacher, I'll mention her by name, Heather McAlone, has been doing a great job. Aaron Tate, Tammy Inman, the whole staff there at Clopton has been great with connecting with my kids and getting them plugged in. But this is just this is the tip of the iceberg, I think, of where we're going today. And, just there's no unified science behind anything. There's no unified science. And so my biggest gripe is there was an old saying that my dad always used to say, there's too many chiefs and not enough Indians, because there's so many people sitting around trying to have authority and trying to sit around and say, okay, there's this, and this. Well, but nobody's wanting to really take responsibility and saying, here's the guidelines we're going to go with. We want to say, stay quarantined. If you're vaccinated, 10 days. If you're not vaccinated, 14 days, not showing symptoms. Boom, done, over with. And the frustrating part, Sean, is just that there's nobody stepping up to the plate and really taking any responsibility in this whole situation, because nobody knows really what the hell's going on.
Yeah.
And that's what bothers me more than anything else, is that nobody knows what's going on and everybody's afraid to say anything or do anything. And we just gotta look the local. We're gonna go by what the state. And I've never seen more passing of the buck. And I've and through all of this, talking, and I've got to talk a lot this last week in my quarantine, talking with my teacher friends in districts around the area, I've talked to a couple of administrators who are at their wits' end. I mean, there's some teachers who they're like 3 or 4 years from retirement. And they're like, we're done after this year. We're done.
Mm-hmm.
It's ridiculous. And then to get a sub for the first 2 days of this week, to get a sub was near impossible. Now I had a sub scheduled for Thursday and Friday because of YAG, but you can't get any subs because nobody wants to take the risk.
Sure.
And I mean, we pay good for a rural district, paying $85 a day. That's you're not going to get any any jobs like that. And so there's no exact anything to this, and I think that's been what the whole frustrating thing is behind this. And I think we kind of want to get into a little bit, if you want to carry this for a little bit, or if you have anything you want to ask me about, we can, and then go about talking about Aaron Rodgers too, because I have even though can't stand Green Bay Packers, but that's okay. But Aaron Rodgers as a person I think is a stand-up guy, and he's a great athlete. And and I watched his he had his interview on Pat McAfee show last week, and but after hearing that, and I think it was just God's hand saying, okay, now you're going to get a little touch of this so you can have some empathy for other people. Boom, here you go. And then have to go through all the ringers of bull crap that's out there, these hoops that you got to jump through, and that, and then and the other thing is this, I don't know if you've heard of this, but the monoclonal antibodies infusion. This was the first, and I consider myself to be somewhat up to date on this. That was the other thing. So and I got this done in the ER, not that it was an emergency procedure or anything like that, but I had to sign a waiver. And I said, what's the waiver for? And she said, well, it's not FDA approved. And she said, are you okay with that? I said, up until this point, nothing bothered me. I said, how effective? She said, 95% of people who get it don't have side effects. They don't. I said, yeah, I'll take the risk. And she was, pretty much dead on by Wednesday afternoon at 2:00, 3:00. I just felt like I had a head cold, and that was it. Fever was gone. Aches were gone. Now I cannot smell anything, but I'll tell a story about that later. But this is what's going on is pure madness.
Yeah, and I think it stems just from a lot of uncertainty that we've kind of seen from the beginning. Individuals like Fauci who are completely under a desk now, but they're keeping him off of the screens for a while. They're a little bit smarter than they look in that aspect. But yeah, it was just because he was flip-flopping left and right. And then when people said, oh, no, he was not, well, then check the emails that leaked. Yes, he was.
Yeah, he was.
I think there's a couple issues I have with kind of everything that we've seen since COVID kind of started. I am a firm believer science should not be political. I just don't believe that science needs to be political. Medicine doesn't need to be political. However, it is. Regardless of how we want to feel, whether we think it should be or shouldn't be, it is. So we need to stop acting like we can't have the conversation. It's bullcrap. It's absolute bullcrap because people made it political when they started adding insults and like this. I'm so tired of people acting like stuff just isn't political anymore because people made it that way. And the thing is, like, what is frustrating me more than anything, if you take before COVID, right? People were always preaching, it's your body, you're right, you do what you want, you treat people how you want to be treated, you treat people with the respect, if they want to be vegan, if they want to do this, okay. Well, Then you take people who, even if they have the vaccine, I just want to talk because, and people might give me so much flack, and I just don't care. But look at things like ivermectin. Okay, I have not had COVID. I have tested numerous upon numerous of times, and have had zero. I've not had COVID. Well, look at the response to what ivermectin has done for people across the globe and other nations and people that have access to it. It has worked wonders for these individuals. There's nothing wrong. Why would you not want these people to get healthy? Now, the second someone mentions it, like, yes, I used ivermectin, that my fucking doctor prescribed to me. And then the next thing you see is all these people talking about how, it's a horse dewormer. They're taking animal pills. They're getting it from Orscheln's. They're ignoring everything that the person just said before, when they clearly state my doctor that I paid a lot of money for, that is very intelligent, that knows more about the coronavirus than you do here on Twitter, you fucking nimwit.
Right.
And they just write it off like it's no. Like, hey, if you don't want to take doctor prescribed ivermectin to get better from coronavirus, then don't. Then don't do it. Don't do it. But if it works for someone that has coronavirus and it helps them with their symptoms, with getting over it, why would it make you upset? Why? Why would it make you upset that someone uses it to get healthy? I just don't get it. And then the same with the monoclonal antibodies. Is so many people were talking crap about it a few weeks ago. All kinds of people. Why? Because the people that were mentioning it didn't fit the narrative of what they wanted to hear. Okay, people were talking about how, hey, this is a new, relatively new thing.
All right, sorry about that, folks. We had a little hiccup, which is what happens when your children start out the podcast with you and they are tripping over your cables and unplugging my computer and not even knowing it. I am so sorry about that. But we were talking ivermectin, Sean.
Yeah, and so, and it's not even, just like ivermectin. I think my issue is that there are some individuals who even have the vaccine that are using other methods to help assist them to help get over COVID. And yet we can just continue to hear this narrative about how doing that is wacky, it's cuckoo, it's witch doctor medicine, it's ridiculous.
Yeah.
And my thing is, my big thing is I have no opposition against the vaccine. I encourage people to get the vaccine.
It's all the shaming. It's all the shaming that's going into it that's really pissing me off.
And it's the big holier than thou.
Yes,
like the holier than thou. Because here, people are still getting sick with the vaccine. It's not. People with the vaccine are still transmitting the coronavirus to other people who also have the vaccine.
Don't you think by now, though, that all of the misinformation and all of the ignorance and everything, I mean, shouldn't we have cycled through, since this is part of the 24-hour news cycle, don't you think that we should have cycled through this by now?
No, because people just aren't ready to be wrong. They're not ready to be wrong on Twitter. They're not ready to be wrong on the internet. Could you imagine? I'm not even going to say the names. You know for a fact exactly who I'm talking about. If that socialist wizard suck up was told that by Fauci or by one of those liberal gods that they all fucking praise, that, hey, actually, this, we're going to start using ivermectin to treat people.
They would jump on it in a heartbeat. Jump on it in a heartbeat.
In a heartbeat. And we just say, oh, well, we were just, we were just cautious. We were just waiting. It's difficult. I think this is just the trend though. For guys like myself and guys like you, we pretty much sit right in the middle of a lot of things. And I'm a very liberal individual in uh, a lot of the things I believe in, but I'm very conservative when it comes to my economic beliefs. Okay, there are. This is just it's gotten to the point where oftentimes it's not even a matter of like, oh, you don't have the vaccine, whatever, man. Like, I've got it. I'm doing my part to stay, but it has become a witch hunt against individuals that are not vaccinated, and it's just weird. It's weird that it has to be like that.
And so, since you're talking, go ahead and get into the. Let's go ahead and lead into the Aaron Rodgers thing then for us.
Okay, so for those that don't know, and if you don't know, you might be living under a rock, but Aaron Rodgers is the quarterback for the Green Bay Packers, superstar, the discount double check, Super Bowl winning MVP.
Which we'll talk about that too.
Yeah, big shout out to State Farm. But this was an individual who, towards the beginning of the season, had been asked about his vaccination status, and his response was, "I am immunized." That's what he said. So, fast forward months later, and Aaron gets COVID and had not been vaccinated. So then starts the witch hunt of 2021, the largest one we've seen so far, in my opinion. And so many people came down on him, and not all of it was unjust. He definitely could have, and he had even spoken about this when he had apologized to numerous people, where he had said, "I should have been more clear as to what immunized was." But he by definition didn't lie. He didn't say he was vaccinated, and said that he had been immunized, and had gone through with doctors a different protocol to help him be prepared for if he would ever get coronavirus. Now, here's a big thing that people have not taken into consideration. They won't. This is what gets me. He has an allergy to two of the possible 3 vaccines that you can get. The third one that he does not have an allergy to was the Johnson & Johnson, in which at the time of the question of had he been immunized, when he was looking at the Johnson & Johnson option, it was being recalled.
Mm-hmm.
It was being recalled.
Right, with the side effects that were going on, right.
So, and here's my thing. And this is what gets me too. Because I would feel the same exact way. If I was a multi-million-dollar athlete, the face of a franchise, that literally the fate of Green Bay literally rides on this guy's shoulders week in and week out, is if you might have a fear, if you have seen what has happened in the world, where you have seen how people have responded from COVID that are similar to you, okay? Now, and that's not to say COVID is a very different beast. It is. It can affect anybody any different way. But the thing is, if you look around at how people had recovered from COVID, and people in his situation, after talking with doctors, I don't believe that's the funny thing, is people act like he made this decision on a whim. I think there was a lot of time spent.
He's got a lot of money tied up.
Doctors.
He's got a lot of money tied up in this too.
And he also puts a lot of value into his body, and with making the right decisions for him. Okay. If there could have been a chance that the Johnson & Johnson vaccine could have caused an issue with him and his sports performance, why would he get the shot? Why? Right. You know what I'm saying?
Right.
That's what's, one of the wild things. But, he had spoken about his treatment afterwards, again, using ivermectin, using monoclonal antibodies. And he will be back this upcoming Sunday.
Yeah, and he's cleared
tomorrow.
He'll
be back tomorrow.
But
and he will be playing Sunday against the Seahawks.
And so if you haven't watched the interview, go over to the Pat McAfee show. That's the only place where he issued a public statement that I'm aware of. But that will be the only place where he continues to. And it was a 45-minute, and he went on this whole thing about, he's like, it's a witch hunt, like you said, Sean. And so, and then on YouTube where you can click below like corresponding videos. So there's an ESPN interview below that. So I click on that afterwards. And it says, there's people who are just straight up mocking Aaron Rodgers. Well, there's not a witch hunt, blah, 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 blah. Aaron Rodgers, they're talking like he's a total kook. And that made me more upset. How dare you? I mean, this is a guy, like you said, who's very in tune with his own body, and he knows what he feels is right for his body. He's taking care of himself. He never even had to get the infusion, and he was like, the day after, he's like, I'm fine. And what really, really upsets me is, and then he talked about, well, I have to wear the yellow, like what he said, like a yellow wristband wherever he goes, basically saying, it goes back to biblical times when you had leprosy, unclean. Here's my little, and yet he has to go to news conferences. He has to wear a mask, even though everybody in the room is vaccinated, and he's not, but he's still got to wear a mask. Oh, now tell me, what's wrong with that picture? There's 1,000 things wrong with that. If everybody else is vaccinated, why does he have to wear the mask?
Well, look at some of the stupid shit that the NFL does. Like, make it make sense. That's my issue, is make it make sense. If they're in a dome, masks on the sidelines. If they're in an open stadium, no mask needed on sidelines.
I didn't know that. I did not know that.
Yes, yes.
Oh my gosh.
And that's the funny thing too, is literally, the retractable roof stadiums, like even if they have them open halfway, cracked, they count. That counts as an open stadium. He had talked about it. He's like, make it make sense. And even that's the thing too, is the NFL just caved to the people's demands of finding him. Because like he said, he's like, the Green Bay Packers organization knew I wasn't vaccinated. The NFL knew I was not vaccinated.
He's still
no one said a thing.
Right.
No one said a thing to me whenever I was doing interviews. No one seemed to give a shit. Nobody cared.
Right.
Nobody cared. And he had even spoken. He's like, I got coronavirus from a vaccinated player. I just think that, again, and it's not just celebrities. It's people in general who I hate that this is where it's come to, is the amount of shame on you, I'm better than you, that we can continue to see. Like, people are nasty. They're nasty with the words that they're choosing. And here's the funny thing too. There are so many, what I would consider like silent majority out there. Like remember when Trump won the election and people acted so freaking surprised, but there was this big silent majority that just didn't speak up because they didn't want to speak up because they were afraid to be called pieces of shit, whatever it was that people were going to throw at them. The funny thing is that people can't deny about the COVID vaccine, is it's all walks of all different political aspects and avenues. There are Republicans that are very pro-vax. There's Republicans that are anti-vax. There's Democrats that are pro-vax, Democrats that are anti-vax. It's literally such a big divide amongst individuals. And so both sides are trying to eat each other. It's funny. It's funny seeing certain celebrities that kind of, had gotten in some like trouble. Ozzy Osbourne had kind of been like out of the public eye for a while just because of all the shit that he had stirred up a while back. And then all of a sudden he was like, this is my opportunity to say, if you're unvaccinated, you're a piece of shit. And then people like, oh yeah, go Ozzy Osbourne again.
Right.
Yeah, we're back all for Ozzy. And it's,
well, here's the other thing. So let me put the flip side of this coin. This is the other thing that pisses me off. And so living where I live, and I want to go by this step by step so I don't overstep some, because my thoughts run together sometimes when I do this. But living where I live, and I love where I live. I love the community I live in. I love that I'm living in Missouri, not in Illinois anymore. Let's put it that way. And but I get, because I live in what one of my friends called a transparent house, because I am very transparent on social media, and we do this. I get a lot of rocks thrown at my clear house, glass house, because people say, well, how'd that vaccine work out for you?
No, yeah. That's,
I'm like, okay. So when I was let me just go back to the emergency room when I was getting the infusion. When I was talking to the nurse who was giving me the infusion, she says, I'm glad to see that you got your vaccination and that you did the right thing. And then I had a respiratory therapist who's a parent of one of my students who typed me this big old long paragraph and sent me this encouraging text saying, hey, don't let anybody give you, because I had posted this on Facebook how mad I was about it. And this friend texted me and said, as a respiratory therapist, I'm in the emergency rooms, I'm in the ICU wards, I'm in where these people who aren't vaccinated, who think that they thought that they were invincible and they could get by, I don't need that vaccine. There are some people Aaron Rodgers, like you said, somebody who takes care of it. They also mentioned Russell Wilson, the quarterback for the Seahawks, who spends he spends $1 million a year on his body.
On his body.
And I don't believe he's vaccinated either. And
I don't know. I don't know his stats.
I don't know either, but for me, okay, I am not a vision of health. Okay, I am overweight. I'm morbidly obese. Okay, I have a history of heart disease in my family. I have a history of prostate cancer in my family. I'm 47. I'm relatively still middle ages now. But I am not in any position to say that if at first I originally thought, okay, if I get COVID, I could beat this thing, but I'm going to go ahead and get in the back of my mind, I said, I've got to get vaccinated because I want to do the social responsible thing, and because I'm around other students and because I'm around. But it turns out then as I get further into it, and I talked to this emergency room nurse, she said, basically, she said in a polite way, hey, fat boy, good thing you got the vaccine because else you'd be breathing through a tube right now. And so that's the thing. And it's like you said, the shaming is going on both ways. Damned if you do and damned if you don't. And if you do, we still got the the QAnon people. Oh, you got the chip in you now, and you've got those whack jobs over there.
Yeah.
And then you got the people who are like, well, but I do respect people's rights to say no. Now, there was I don't know if you saw, there was a KHQA reported this afternoon that so this is just an example of where we need to draw the line. Okay, so Blessing Healthcare Systems, which is out of Quincy, Illinois, we have Blessing Health groups throughout the area. There's rural clinics all over the area. And so Blessing Health Systems today issued a statement saying that there's a deadline, I believe it's December the 5th, that by December the 5th, all healthcare personnel have to have the COVID, either the first shot or the Johnson & Johnson or whatever, or after December the 5th, they can no longer work for the healthcare system. But yet, it blows my mind that 1 year ago, we're holding the nurses and our healthcare professionals up to in a high standard, and we're saying, you guys are our heroes, you're our frontline heroes. And I mean, these were people who were risking their lives every day, going in, facing this vaccine head on, or facing this virus head on without a vaccine. And now we're telling them, okay, we're going to fire you now because you don't have the vaccine. But yet where is the what was the term that Aaron the body autonomy? Where is the body autonomy at? Where is it to where you know the whole thing about how we have such a double standard? We can say, okay, when it comes to an abortion, my woman's choice. But when it comes to the vaccine, by God, better have that thing in your system right now. You know, you cannot, especially in the nation that we live in today, you cannot say you're going to do this. We live in probably one of the most rebellious societies of all times right now. And if you tell somebody literally you're going to do it, forget it. Forget it. You can't make people do something. And you know, all these and some of the constitutional professors, these guys who I've been reading about with this whole thing with Aaron Rodgers. So within, and I think I've mentioned this before, but it falls underneath the 10th Amendment, and it's the philosophy, the idea that the 10th and the 14th Amendment, that the state has certain police powers that can deny you your due process rights in the name of public safety. Okay? That's a theory that's out there. And so this is what they're running with right now. This is what they're running with right now in saying, okay, we're not protecting, we're protecting everybody else from you. And that's their mentality of going through when they say this, when they do this, they're saying, look, you're not smart enough, or people aren't smart enough to take care of themselves. So we're going to take care of them for them, and we're going to take care of you for you because you're not smart enough to do it on your own. So therefore, we're going to make you get this. You know, and that was something else that came out a week ago, or it will be a week ago tomorrow. A federal judge in Louisiana has put a hold on the federal mandate for all workplaces with over 100 people in it. They have to have the vaccine. And the federal judge has already put a hold on that. So, you know, to me, we have this is like a multi-headed dragon that we have in our midst right now. You know, there are so many aspects. And as you said, so it's politicized, which that doesn't help anything that it's politicized. It doesn't help anything that it's a divider of people in both parties. It's a laughing point for people who are, you know, but yet people who are, they've made their decision. So let them, you know, where are you at? I mean, do you think that I know what you're going to say, but I believe that I'm at the point now. I was at a different point this summer, but now after having it, after being through it, after seeing death in my family, after seeing all of this, my opinion is this. It's a personal decision, and it should stay that way. It's a personal decision that people should keep to themselves. If they don't want to get vaccinated, then don't get vaccinated. If you want to get vaccinated, but recognize that vaccinations, you know, we can't say this whole thing, oh, it doesn't save anybody. I'm now before you living proof, after having a doctor and a nurse tell me this week that the vaccination, due to my physical shape, saved my life. Whether I want to believe it or not, they look at me and they say, so, I mean, that's where I'm at with this. And what has happened is just beyond belief.
Yeah, I am a firm believer in vaccines. I believe that vaccines work. I also believe in freedom of choice. Mm-hmm. And that goes for every single thing, okay, when it comes to your body. I am also a firm believer that what people should do is they shouldn't just treat the vaccine as the be end all. There needs to be due diligence and responsibilities to make sure that people are doing what they can to make sure that their body is prepared for the virus, and not just by getting the magic shot and then trying to go out and about and doing whatever they want.
Right.
That involves doing what you can to ensure that your body is going to be healthier long term. I'm not a shortcut individual. I never have been. I never will be. I believe in hard work. I believe that, the hard work pays off. And I wish as a nation we were healthier. I wish as a nation we did more than just settling for the bare minimum of getting the jab. I mean,
yeah.
And I hate saying it like that, but look at the money that was made at the end of the day by certain individuals. And if that if that alone doesn't make you go, maybe just maybe there was a reason. I wouldn't necessarily call it an agenda, but there's a reason why Moderna went over. There's a reason why Pfizer went over. There's a reason why Johnson & Johnson went over. And there's a reason why there's a lot of people that made a lot of money off of them. And those individuals that made a lot of money, guess what? They're the same people pushing for the booster.
Well, I don't need the booster now.
Yeah. And I'm not saying that the booster's wrong. Get the booster. If you are immune compromised, get it. I have no issue with it. I am. But I think it's crazy because now, guess what? Guess what's coming next? This one's going to be big. Is now that they have approved the vaccine for children ages 5 to 11. Now we are coming on in the next couple of years. Next year, it could be next year. Imagine this. Imagine how the United States will react if the COVID vaccine is mandatory for public schools next year.
Yeah. Well,
students.
We've been totally neglecting some of our comments here. Tammy McPike says, question is, how many more injections is it going to be now that it all started with the first jab? And
here's the thing though. Like we get flu shots every year. And like I said, I'm not opposed to vaccines. You go back and look at some of the data, like when people talk about, well, smallpox was eradicated, we've almost eradicated polio, all these other diseases. I'm not disagreeing. But guess what? Take a look at all those, and if you try to say otherwise, you're wrong. You're straight up wrong. But if you look at how long that's the thing. Look at how long those vaccines had been studied, had been researched before either A, they became FDA approved, or before they regularly became used in the United States. Okay. I'm not saying that the science and that I'm not arguing against expedited research for the COVID. I'm not one of those that, it came out too fast kind of things. I'm not one of those individuals. Me personally, I'm not that kind. That's not my thing. However, to act like it's crazy, why people should be like, hey, I want to wait to see what the long-term effects are. Sorry. And the fact that people are like, oh, how Greta Thunberg, how dare you?
I knew she was going to come up sometime. All that little twist.
Just how angry people get of like, hey, it's like, I just want to see what the long-term effects are just so I can be sure. And then if I see, in 2 years from now, 3 years from now, people are fine, then yeah, I'm just gonna get it. There's no problem. I don't think that we should have to worry about how many jabs that take place with the booster. Look, I don't genuinely believe, and like I said, the numbers are so small. But if you're an individual that might be scared of clotting, like look at me, I'm afraid of sharks. So what do I not do? Go in the fucking water, okay? So if I was afraid of clotting, right, then maybe the vaccine wouldn't be for me. But I know me, someone that's super healthy, clotting probably wouldn't be an issue for me. However, there are things that, people have to, that they should worry about. Um,
Another thing that and
there's
our good buddy Matt Edelman is on with us tonight. We should have had him on tonight too, but he said, and but we really should have had him on after this comment he makes. So he said, choice comes with a responsibility. What is the responsibility of the unvaccinated to the public? When does choice yield to public health and safety? I'll let you.
see,
I get that.
For me,
I get that, but again, it's like I'll liken, this is probably not the best example, but I'll liken it to safety belts. Okay, I'll liken it to seat belts. If I say, okay, I have the right not to wear a seat belt, but I know that choice is going to come with a consequence if I do get into an accident. Okay, is that affecting public health? You could argue that it could. I mean, if it starts to spread, people say, he's not wearing a seatbelt. He's not wearing a seatbelt. I'm not going to wear a seatbelt. Well, then you end up through a windshield. When it comes to a vaccine, all right, if people, and I think you were getting ready to get to this, if people are concerned about being sick, if people are concerned about getting sick, then get the vaccine. If people don't want to get the vaccine and they're recognizing for whatever reason that they don't want to get it. I'm allergic to it. Like you said, Aaron Rodgers was allergic to two of the things. I'm allergic. I'm going to take my risk and do it. Okay, well then that's the way it is. The thing about it is that we've turned COVID into this. It has become. It's a beast that we've never seen before, really. I mean, we've heard this over and over again, but what are we now? We're going into next March will be year 3, correct? So year 3, and we are going to be still talking about this in March. We're still going to be fighting this in March. It's not going away. The numbers are on the rise, and the death number is on the rise in Europe, but we're tracking the right way here. This is there's so many things that do not make sense. Like you said, the guys who are making the money off of this vaccine, that it, and they're still in the early terms of this when you have long-term research, what are we talking, 5-10 years, right? Does that sound right? 5-10 years on.
That would be longer-ish, because typically from when I looked up my research and all the literature that I read, I didn't just like look up a news article. I tried to do a little bit more digging into. It's the good thing about having an EBSCO host, you still have scholarly articles.
Yeah,
is the average that I was finding for things like HPV, smallpox, chickenpox. Well, smallpox, that the first ever vaccine that was attempted or that was researched was from the 1700s.
Yeah.
Okay.
Yep.
Yeah. So, but if you look at a lot of the research and a lot of those before they were administered regularly to people in the United States, whether they became FDA approved or not, it was about 10 years or more. I mean, there was a lot of research done. And again, like I said, I'm not opposed to the expediting study and research that went into the COVID vaccine. I'm not saying that is necessarily an issue. But like, I do think it's wild that some people, get upset, if people look into things like myocarditis and they're, potentially worried that if, like, for example, let's put my family into perspective, right? Well, it's a flip of the coin for me. For someone maybe like myself, let's say if I was a little bit more immune compromised, because what do I know? I know that heart disease runs in my family. That's what I know. I do know that the individuals that suffered from heart disease in my family were typically larger individuals that were already on blood thinning medication,
right,
or were taking meds for their weight. Now, there are there are reported studies and cases that the vaccine in young men especially may cause an increase in myocarditis. For someone like myself, that's something that I should think about, because I can also take and look at the studies. Okay, well, what are the numbers of people, of young men that have had COVID-19, and what were the side effects that people my age were having? What were the numbers? Was it, of people that were dying my age? Was it 1 out of 1 million? Was it 1 out of every 2 million? Whatever the number was, versus, okay, well, what was the percentage of young men based off these research studies of the vaccine that ended up getting myocarditis? So if I am an individual from a family with a history of heart disease, okay, why would I potentially get a vaccine that might cause me to have heart problems if I'm from a family that has a history of heart problems? But then let's say if I looked at the side effects, the long-term side effects of COVID, and looked at, okay, is myocarditis there? And then what's the percentage? That's why, there's so much.
Right. There's so many variables that you can plug into, and you're just focusing on one. That's just one.
Yes. And see,
I mean, what, infertility,
to really dive into
stuff like that.
Yeah. There's all this to really dive into Matt's question. It's when we look at like the numbers of, people that that can get COVID. So if you look like what the CDC was reporting, and typically people that are asymptomatic, if they have the vaccine, are typically people who are lesser immune compromised. Okay, these are typically people that they're vaccinated, that might not have as many outlying health conditions as your typical average Joe. Mm-hmm. Well, then you look at people that are vaccinated that are immune compromised, and they're typically having symptoms, and they're typically more likely to spread COVID. Okay. So, well, what does it mean to be, how many, what's the justification of these people that are immune compromised? Like you said, maybe if you're overweight, let's say you have more respiratory issues and then you start coughing more. Okay. Yep. Does that mean that are you potentially more likely to pass it on? It's tough. But then it's also like, okay, well, let's say if you're an unvaccinated person, well, why shouldn't you just be able to test daily? Why shouldn't you be able to test daily and say, hey, if I'm negative, I could be able to go out. If I'm positive, I stay home. I feel like that's fairly simple enough.
And Matt also brings up, he says, guys, the technology for this vaccine has been around for decades. It's not new. And I do understand that as well. And I think, and like we said, this is a wormhole that we can really chase a long way down. But at the same time, I want to bring out, and I want to say, let's be clear again here, so we're not muddying the waters up too deep. We are not against vaccination. We're not against vaccination.
Yeah, I'd say you and I are very pro-vax.
We're very pro-vax
for the most part.
But again, being this show what it is an open forum for discussion. That's why we open it up for all of our viewers here. And again, I've got a ton of comments on the feed here that we haven't touched on. I apologize that we're not getting to every one of them, but this is the forum for that, because we have to look at the times. And again, part of our discussion is here, where is personal choice? I think the real question that we've come around to 2 or 3 times, the thing that we keep on coming back around to, though, is, where do your rights end and the other guy's rights begin? That's the question. I think that with every constitutional, with every legal, with every personal issue, where do the rights of one end and the rights of another one begin? Because if I say, okay, your rights are to be protected, so here's the example, and it's a silly example, but the example I always gave, and Sean, you probably remember this, the example I always gave in my government class, okay? I have the right to have crazy hands, okay? I have the right to have crazy hands and go around with crazy hands until my crazy hand comes right within an inch of your forehead, okay? That's where my right to crazy hands in is, right there at your forehead. This is not one of those clear-cut cases because I don't know how else to go about this, because this is something new, because we want to protect. I agree with what Matt was saying. We want to protect our society, and we want to protect people against the vaccination or against a virus. But if it comes at the point of personal freedom, are we giving up one? Are we giving up one evil for? Are we giving up a freedom to gain another freedom? Or are we giving up a freedom to gain another evil? Where there has to be, if people want to choose to get it. I chose to get it because, for whatever reasons, now I'm on the side of, hey, I'm glad that I got it, because I probably, with my state of health, I wouldn't have been able to survive it. But if I'm going to say, you have to, it's like me saying, okay, if you want to survive going to hell, you have to become a Christian. You're going to be a Christian. Well, I can't twist your arm and make you become a Christian. If somebody says, you want to survive this, you've got to get the vaccine. No, I could do a lot of different things. I could, by your advice, Sean, and again, I'm not giving this to give Sean a big ego or anything, but Sean, a long time ago, told me, before we even did the podcast, we were talking stuff. He said, hey, V, I remember, I forgot what it was. Maybe it was up McDinger's or something like that. He was like, hey, I know one thing, bump up on your zinc and your vitamin D. You told me that from the very beginning. And by golly, we take zinc like it's going out of style around this house. I take vitamin. The kids don't take vitamin D as much, but I take vitamin D like it's going out of style. I take zinc at least twice a day, and I take vitamin D at least twice a day. Once in the morning, once in the evening. Mm-hmm. There's no such thing. And with everything with the drinking fluids, real fluids. Mm-hmm. I can tell you one good thing about COVID has been, it makes soda taste absolutely terrible to me. It actually dries me out a lot more. It dries me out a lot more than, so, I think that, I don't know. It
would be interesting, right? Like, let's say that an executive order gets signed and it gets passed through the Senate and the House, where mandatory vaccines became law, right? I wonder what the reaction would be from one side or the other side. We'll say pro-vax side. What the reaction would be from pro-vax side of, like, yes, we've won, everyone's going to get vaccines. And then they also came out with, but based off the science, we are also shutting down immediately all, let's say, fast food restaurants that fit into this category. Okay, all employees will be supplemented until you can find new lines of work. Also, with the new mandates that start with the vaccines, Americans will be required and monitored to do 30 minutes of cardiovascular exercise a day. And they're saying, based off the science that we have, one of the most rapid way of transmitting this disease is through respiratory issues, and so we want to ensure that the American way of life is not threatened, because we have the most healthy respiratory systems in the world. People are exercised, people are losing weight and making it happen. They're not eating junk food. We're doing what we can to strike against it, and they're like, "Whoa, we did not sign up for this shit. We did not sign up for this." And but that's one thing people do need to consider, and they can call people like you and I crazy.
Yeah.
But we know this, we see it. The moment you give government power, they will never relinquish that power again.
Right.
Okay, that is, and again, I'm Army National Guard. The vaccine is mandated for me. Okay, I don't have a say, but I knew that when I joined the military, that was something that could potentially happen, and that's something that I'm willing to go through. I don't have a problem with that. But we should always question the moment that a higher power tries to force us to do something, to conform, to make it easier for them. It should always be questioned.
Mm-hmm.
It should never not be questioned.
Right.
But that's just my old kooky right wing, conspiracy brain that's just popping off that people will go on about. But I guess in closing, for me, I would say I encourage you to do your research. I encourage you. The most important thing is don't just do your own research. Consult with a doctor. Speak with your doctor.
Mm-hmm.
Get advice from them.
Mm-hmm.
Get advice from your doctor, not someone you're listening to on the internet.
Right.
Go to a doctor. Get the best medical advice for you.
Mm-hmm.
Have the conversation with yourself. Have the conversation with your family, and do what is best for you.
Right. Exactly. I can't agree with you more. I mean, this has been an excellent topic for us tonight, and goodness gracious, I mean, again, I've got about 8 or 10 different comments we didn't get to tonight. All great points. And man, guys, this was something that hit close to me. I mean, it became very real to me this week. And to close out, I'm going to say this too, Sean. I was, so Tuesday night, staring this in the face, I was quite frightened. I was very afraid for the first time in a long time. I was sitting and looking at my life and thinking, what do I need to, where do I need to go from here? Because it was a wake up call, like you said, because there was a point 3 years ago, it comes up on my Facebook timeline that I was running 3 to 4 miles a day, and I was down to 283. Right now I'm at 335, and I'm not in the best shape of my life that I once was. And this is a wake up call for me, and I'm definitely going to be calling your girl here before long and about getting some advice about which way to go, because this is a, if anything that I can draw from this experience is that I need to take better care of myself, and that I'm glad that I did have this vaccine to kind of be a safety net to keep me from getting worse. And so, I mean, exactly what you said, be talking with your physician, especially about, if the vaccine's right for you, not right for you, but also be thinking about, hey, maybe this is a time that I need to start looking at myself and saying, maybe sitting on the couch every night, coming home from work, plopping down, having a nice cold soda, nice cold beer, and whatever, maybe I should start with just taking a walk around the block, or taking me a 30-minute walk at night, and build on it from there. And, this may be a topic for future shows, but, something that we can look at. Maybe going forward,
maybe we could start doing something like that as we kind of roll into the new year, maybe we do something of like I wouldn't call it a fitness challenge kind of thing, but kind of a way to keep the ball rolling on those kind of things and get our listeners involved and stuff like that.
Yes.
That would be that'd be cool.
That would be cool. So good discussion.
Well, thanks again for everyone that listened tonight and dealt with the nonsense that we kind of had in the middle there with the show going out. We appreciate you guys coming back, getting back on the live stream and giving us a listen. Tons of great comments, and I saw across all our different platforms, we had viewers live listening on Facebook, we had viewers live listening on YouTube and on Twitter as well. So thank you all so much for checking out the show.
Share us.
Again, we really can't do it without you guys. Please, if you can, give us a share. Give us a share here. And I'd really like, what I'd love to see is, we'll definitely on Monday, whenever we go live for our show next week, we'll get a post out about half an hour before we go live, just so that whenever we do go live, we encourage that anyone that logs on when you first watch us live to give us a share. I'd love to see if we can beat like 15 15 viewers live while we're on.
Right.
And
that would be great.
Comment, and
that would be great.
Awesome.
Yep.
So,
Thank you very much, guys.
Yeah, we'll see you next week.